Hi everybody, how you doing? Dr. Tony Rhodes here, chiropractor in Tigard, Oregon, and hope everybody's having a great new year. I'm shooting this video here because, man, in 2020, I've had so many patients, way more than I normally do, come in with low back pain and neck and back pain from just sitting too much. So many people are on Zoom right now. I'm calling this whole generation the baby Zoomers. Everybody just growing up on Zoom and just sitting a lot. And it's not good for our backs, not good for our spine. And so I'm just going to pull up a quick graphic because a lot of people have been coming in with lower back pain, wondering, gosh, why the common statement is, I didn't do anything. And that's the problem. They're sitting and not doing anything. And our backs don't like that. They like movement. Movement's medicine. That's part of, what chiropractic is getting the body back in motion, getting it moving, getting things functioning like they should. So I think I can do a screen share here real quick. And so what this graphic is showing, see if I can pull up a little marker here. Okay, that does work. So yeah, people don't realize this. This isn't really an intuitive idea, intuitive thing. But so the disc, when you think of the disc in the low back, if you look at this model of the spine over here, the disc is this cartilaginous piece of material here, and it's not the bone. So some people say have a slip disc and they're referring to the actual bone slipping forward, a spondy. But whenever you hear disc in the medical community, they're talking about this. I kind of describe it to patients as kind of a sponge-like material, because when you sit, it gets squished, and a lot of the fluid can leave and can degenerate over time. But when we sleep, it can rehydrate, or actually astronauts that go to the moon and stuff, they come back taller because those discs don't have gravity working on them. So anyway, what this graphic is showing is that when we sit hunched over, I'm going to circle this one here. You can see the 185 of this guy just kind of sitting as if you would sit like I'm sitting at a desk right now. That's 185 kilograms of intradiscal pressure. You don't really need to know what the numbers mean right now as far as the specifics, but just keep that 185 in mind. So there's 185 kilograms of pressure when you're just at a desk sitting there. And then let's back up. Let's go down the notch here to the 100. So there's 100 kilograms of pressure, almost half of what is the pressure that when you're sitting. So when you're standing, so that's why some people feel a lot better with when they're standing and working, or a sit stand desk. So I'll often ask people, does it feel better when you're standing? And they're like, yeah, it actually does. That could indicate, all right, maybe we're dealing with some pain in your lumbar disc. And so 100 kilograms of pressure, a lot less. And here's the other thing: when I'm helping people treat a torn disc, disc herniation, anything to do with disc pain, the least amount of pressure in that disc is going to be when you're just lying flat on the ground. So you can see 25 kilograms of pressure that way. So significantly less than being hunched over, at a desk or standing or stooped over. And you can see some of the things that put the most pressure on your spine is when you are, sitting down, like this last picture, really hunched over, and you see he's got something in his hand. He's picking something up. So picking things up. So, that puts the most load on the back. So, if someone's got a bad disc, I tell them, hey, no BLTs, no bending, lifting, twisting. That can really put a lot of pressure on that disc. And I tell them, you got to be, taking some naps or resting during the day where you're laying down, and often putting a pillow under your legs there. So hopefully just this quick graphic helps people understand why their back can hurt so much when they're sitting, because there's a lot more pressure than when you're standing, or obviously when you're going to sleep on your side. So anyway, I wanted to just share this graphic with people for them to just kind of understand what was going on there. But yeah, there's so many different ways to treat back pain from when you're sitting. Obviously, there's other things you can do, ergonomic setups and things like that. Just get that corrected. But sitting is sitting. There's no way around it. A lot of people got to do it. So I have a lot of people that come in and get treatment, and then we get them stretching and doing yoga. And so there's a lot of other things too. But in my office, that we have a lot of different things we can do with massage or acupuncture, obviously adjustments. We have a decompression table that we put people on that decompresses that disc. So there's a lot of ways to combat that pressure on the disc. And so if you have a question or you want to do a consultation, I'd be more than happy to do that. So just leave me a message. But I hope that helps. You guys hopefully are having a great new year, and I'll have more videos coming soon.